Hi everyone, Blake again with the next video in our video series. In this one, we'll be discussing study bias. It's important to note that no study is perfect, and therefore we must be able to identify biases and try to reduce them whenever possible. This is a high yield topic for your exam, so make sure you know each type of study bias, being sure to examine commonalities and differences between each one. The first type of bias that we'll be discussing is known as selection or sampling bias, which occurs when the sample population is not a fair representation of the target population. In the diagram, we can see that the sample population chosen for the study selected 3 out of the 3 individuals with the condition, while only 1 individual without the condition was selected. This skews the results, as the investigators will believe that the number of people with the condition is much higher than it actually is within the target population. This often occurs due to non-random sampling, exclusion criteria that is not well designed, or no responses from the participants. The next type of bias is known as confounding bias. Confounding bias occurs when the association between the exposure and outcome is distorted by a third variable. In the diagram, we can see that although a study might conclude that alcohol consumption directly leads to heart problems, smoking is often a confounding variable, which means that it distorts the observed relationship between the independent and dependent variable. Those who drink may also be more likely to smoke, which can lead to the observed increase in heart disease. Therefore, it's actually the confounding effect of smoking that leads to the increase in cardiac health problems. Confounding bias often occurs when there is a failure to account for or control confounding variables. Next is subject bias. Subject bias occurs when participants in a study systematically provide inaccurate or biased responses. This can happen either intentionally or unintentionally. The Hawthorne effect is an example of subject bias in which participants intentionally change their behavior or response because they know that they are being studied. For example, if you were to ask your patient how often they flossed, some might say every day because it is the more socially desirable answer, when in fact they do not. Subject bias can also occur unintentionally when the questionnaire is poorly designed, making it difficult for subjects to provide accurate answers. Recall bias occurs when participants recall past exposures differentially. Since traumatic events are more likely to be remembered, these events are more likely to be reported. For example, if you were to ask participants to count the number of times they experienced tooth trauma as a child, those who experienced severe pain may be more likely to report the experience as opposed to those who perceived less pain. Moving right along, the next type of bias is known as attrition bias. Attrition bias describes the systematic differences between participants who drop out of a study and those remaining within the study. For instance, in a study assessing the efficacy of monthly dental bleaching over a 6-month period, individuals who didn't perceive the bleaching as effective might have withdrawn from the study before the full 6 months, potentially swaying the outcomes towards those who experienced early benefits from the monthly bleaching. And finally, reporting bias occurs when there is a selective publication or reporting of study results based on the direction of findings. This bias can occur when researchers preferentially publish studies with statistically significant results or positive findings while excluding studies with null or negative results. This leads to an incomplete representation of available evidence. Now that we've covered the different types of study bias, let's talk about a strategy that we can use to reduce this bias. One method is to use blinding, which is sometimes also called masking. A blinded study, or single-blinded study, is a study in which the participant does not know if they're receiving the actual treatment or a placebo. This is slightly different from a double-blinded study in which both the participant and the research administrator does not know if the participant is receiving the treatment or a placebo. Sometimes, studies can be triple-blinded in which the participants, researchers, and data analysts are all blinded. Knowing the difference between single-blinded and double-blinded studies is high yield, so make sure you know that in a single-blinded study, only the participant is blinded, while in a double-blinded study, researchers, in addition to participants, are blinded. Now, before we move on, what exactly is a placebo? Well, when conducting a randomized controlled trial, it's important that we provide placebos, which are fake treatments given to the control group. Whereas an active treatment could be a treatment pill, a placebo would just be an inert sugar pill that looks identical to the treatment pill but has no effect. You may have heard of the placebo effect, in which some people report feeling better after receiving the placebo pill, even if there are no real physical changes for that patient. Okay, now that we've discussed all of the topics for this video, let's go over some example questions, starting with question 1. Which type of study is susceptible to bias when selecting participants? We have option A, case control, B, cohort, C, cross-sectional, and D, observational. And the correct answer for this question is option A, case control. So for this question, we need to remember that in a case control study, selection bias can occur because participants are selected based on their disease or exposure status in the case group or lack thereof in the control group, which may not accurately represent the general population. This bias can arise if cases and controls are not appropriately matched or if there are differences in the criteria used to select them, leading to inaccurate conclusions about the association between exposure and disease. Next, we have question 2, which asks, what type of error is associated with a third variable that influences the relationship between the independent and dependent variables in a study? We have option A, confounding, B, subject, C, recall, and D, selection. And the answer to this question is option A, confounding. So remember that confounding bias occurs when a third variable influences both the independent and dependent variables in a study, leading to a distortion of the observed relationship between them. This bias can obscure the true association between the variables of interest, making it challenging to draw accurate conclusions from the study results. And last, we have question number 3. A dentist is studying the duration of her patient's oral care routines by requesting each patient to brush and floss in her clinic. However, she suspects that her patients are more thorough in performing these tasks in her clinic compared to at home. What type of bias is her study most susceptible to? We have option A, attrition, B, confounding, C, subject, and D, reporting. And the correct answer for this question is option C, subject bias. So subject bias occurs when participants alter their behavior due to awareness of being observed or studied. In this case, the dentist patients may be more thorough in performing oral care routines in the clinic because they know that they're being monitored by the dentist. This behavior change can skew the results of the study, as the observed duration of oral care routines may not accurately reflect the patient's typical behavior at home. So, to summarize, in this video, we discussed the 6 main types of study biases, as well as the difference between single and double-blinded studies. I really hope this video helped refresh your memory on some of these topics and continue working hard. You got this, everyone.